I think the biggest change is incorporation of self-collection of primary HPV testing into the guidelines. Specifically, we're talking about the HRSA guidelines that were updated in January. Um, I think the other element of the guidelines is just the reinforcing of primary HPV testing overall as a very much acceptable way to do cervical cancer screening in the 30 to 65-year-old population. And I think that it's helpful to just kind of organize how we think about this, that we have primary HPV testing, which can be clinician collected or self-collected. And then the self-collected can happen within a clinical space, or it can happen through at home as in the home in that space. To just to kind of think about this in the broadest way possible. I think that there's probably not complete awareness about the home collection piece. The home collection device that is FDA approved is the Teal Wand. And the Teal Wand, patients can directly access that testing to have it sent to their house through the Teal company and their website. And they have a telehealth platform. And so I think um, for that reason, clinicians may not know as much about it. Um, I will say, I think in parallel, there are efforts happening in many different labs and many different health systems for self-collection in the clinical space to also be going live as a second option for self-collection for patients. And I suspect that there may be more familiarity among clinicians for that piece because that would be something that the clinicians are directly ordering and having conversations about with patients. Patients may be with their primary care provider or they may be with their OBGYN provider, and patient or clinician recognizes that the patient is due for screening. And there may be a variety of reasons that the patient does not want to or would be, preferring not to have a speculum exam, which is what is involved with clinician collection. And so then if the option for self-collection is available through that office or through the lab, then just like they might at home, it's generally a small swab that they would collect the specimen from the vagina. And then there are some nuances as to what exactly how that swab is then handled depending on the lab and the test. But basically, whether in the clinical setting or at home, self-collection in both settings means not having to undergo a speculum exam. I think the guidelines are very much reflective of the times we're in. All of these tests are FDA approved, and that FDA approval process, has been kind of coming in down the pike over the last year and a half to 2 years in incremental ways, the most recent FDA approval being for the teal wand. And so I think the guidelines are very much reflecting that these tests have evidence behind them. They have approvals behind them. And I think from a patient perspective, very much welcome. There is data to show that there are groups of patients that very much prefer self-collection, whether it's in order to avoid a speculum exam if possible, or just in the comfort of their own home with the home collection. I think for clinicians, you know, if this allows us, and the hope is that it does improve our overall screening rates, both addressing patients who may have never been screened and are behind, or patients who may have been delaying screening. So improving those screening rates, I think everyone can be on board with. The tricky thing I think that will be really important to track and monitor in the coming months to years is going to be ensuring that we have systems in place for patients that have abnormal self-collection to be able to get back into the office, or get to the office in the first place, to have the follow-up, because any follow-up that's needed after an abnormal collection is going to involve an exam with a clinician in the clinical space.